What is lupus? Lupus is a long-term autoimmune disease in which the body's human immune system becomes hyperactive and attacks normal healthy tissue. Symptoms may include inflammation, swelling, and damage to the joints, skin, kidneys, heart, and lungs. The history of lupus is divided into three periods: the classical, neoclassical, and the modern. The classical period was marked by the first description of the cutaneous disorder. It is also when the term lupus was coined. Rigorous, a 13th century physician, thought that facial lesions caused by the disorder looked like wolf bites. Therefore, the name lupus, which means wolf in Latin, was coined. In 1872 began the neoclassical period. Marx Kaposi, a student and the son-in-law of an Australian dermatologist, Ferdinand von Haber, marked the description of the disease's systematic or disseminated manifestation. Kaposi even made the claim that there were two forms of the disease, what we know as systematic lupus and discoid lupus. Physicians Osler and Jadashon soundly established the systematic form of lupus. The disease evolved and more science was discovered about lupus. The modern period began in 1948 when researchers discovered LE cells. Patients with acute disseminated lupus were found to have the LE cells within their bone marrow. Among women and minorities, lupus is more common than it is among men and whites. Between 20 to 150 per 100,000 women develop lupus in the United States, and it is most common among African Americans. As mind-boggling as it is, the prevalence of lupus among Africans is much lower than African Americans. The disease can affect all ages, but most commonly begins from around age 20 to 45 years. The precise reason for the abnormal autoimmunity that causes lupus is unknown. Inherited genes, viruses, ultraviolet light, and certain medications may all play a role. However, genetic factors increase the tendency of the development of the autoimmune disease, such as lupus, rheumatoid arthritis, and autoimmune thyroid disorders are more common among relatives of people with lupus than people in general. Lupus, however, is not caused by infectious microorganisms and it is not contagious. Some symptoms of lupus may include skin lesions, alopecia, mouth lesions. Lupus is not caused by microorganisms and is not contagious. You may notice these changes because your own autoimmune system is attacking the good cells in your body. Hence, throwing off other levels or hormones may also affect white blood cell counts and renal functions. Lupus is an autoimmune disease that can affect almost any part of your body, including your joints, your kidneys, your heart, your nervous system, and the brain may also be affected. When lupus impacts the CNS, you may experience headaches, fatigue, seizures, vision problems, strokes, and difficulty concentrating. These symptoms are often referred to as lupus fog. The goal of lupus is to relieve, and organ preservation is priority. Because there is no true cure for lupus, we can obtain this goal by decreasing the level of autoimmune activity in the body and inflammation. Lupus may affect about 1.5 million people in the United States and more than 5 million people worldwide. Around 90% of the people with lupus are women. Lupus is not an easy disease to live with, but people can successfully manage the condition. Most people with lupus can expect to live long, full lives. This can be achieved by exercising regularly to reduce muscle stiffness, prevent osteoporosis, and protect your heart. You can also decrease the risk of coronary artery disease and prevent infections by quitting smoking. Also, getting adequate amounts of rest, and this can help decrease flare-ups and fatigue. And always washing hands to prevent the spread of infections. In conclusion, the Johns Hopkins Lupus Center specializes in the treatment and research of SLE.